Introduce yourself and tell us about your background, how you got to your role where you are today.
So my name is Dr. Suhail Aslam, and I'm a dentist by background. I began my dental journey in 2016 before I moved into public health. I've recently completed my master's in dental public health, and now I work with Living Well, and I work as a community engagement worker with the CVD and the oral health team. A lot of the work I do is out in the community in terms of health awareness, health education, making that small but significant impact for the community. And what really drives me to do this is the ability to give back to community and making those health changes, making people aware about their health before problem occurs.
Right, okay. So you mentioned Living Well. Just for our viewers, what is Living Well and what services? I know you've touched on some. What services does it provide? And I think the difference is that you actually go out in the community, is it?
Yeah. So Living Well is a part of the Big Life Group, and it is commissioned by the Rochdale Public Health Council to carry out community-based health interventions across the borough. So we cover areas like Rochdale, Middleton, Pennines, and Haywood. And what we do is we believe in giving back to the community in terms of making the community aware about their health, being able to teach them in different terms of healthy eating, oral health, smoking awareness, and we reach out in the community to ensure that people are able to access the support they need. So that's where Living Well steps in. It's for the people, and we do whatever it takes to help people to understand their health needs.
So you already touched onto it. Your services cover things like stop smoking, weight loss, getting active. How do you tailor this support to each individual?
Okay, that's a very interesting question. So, because Rochdale is a very culturally rich, diverse background area, so on a daily basis, you deal with different backgrounds, cultures, experiences, ethnicities, and so on. So, a one size fits all approach is something that we don't proceed with or we don't believe in. What we believe is we try to, because with different experiences and background, there is a different perception in health need, different beliefs, different cultures, different adaptations and lifestyles. And what we do is we try our level best to understand where they're coming from, understand and respect their religion, their beliefs, their culture, and adapt the health advices, like the way you frame that advice according to their daily needs or their daily life-to-life routines.
You also help people dealing with long-term conditions. Can you explain how lifestyle coaching fits into that?
Yes. So we have a expert team of health coaches, and they deal with overall in changing behaviors. So scientifically and public health says that to change a behavior in an individual, you need three components: capability, opportunity, motivation. We utilize each sector, and like I said earlier, we frame that advice, we understand where they're coming from. For example, if it could be as simple as smoking cessation. So we try to understand what led them to begin smoking in the first place. Is it stress? We try to cut the root factor, the common risk, rather than focusing on just one aspect area. And we deal with diet in terms of managing your diabetes, your cholesterol, before those complications occurs. As well as we give health and skills. We help people to enhance their skills and feel more confident when they go out in the community. So we focus on a lot of things which share a common risk factor. And that's where the health coaches are really good at what they do.
Just to ask you, how would someone go about getting referred to you or to have an appointment or a session with you?
All right. There are multiple ways in which people can approach us. First of it being is they can visit our Facebook page, as well as they can visit our website. They can give us a call. They could give us email, as well as sometimes you're working out in the community. They are always welcome to approach us in person as well, and we can have them referred, speak to them, and see which services they require. And the services are completely free,
Right.
regardless of whatever services is being asked for.
Right, okay, thank you very much for sharing that. Can you tell me more about blood pressure and the CVD project and why that's important locally?
So, as mentioned earlier, Rochdale is a very diversely rich community, and it has a lot of rich background. So that consists of white ethnicity, South Asian ethnicities. We have the African community and many communities, including underserved communities as well. So the blood pressure project is how it started. We started with taking blood pressures out in the community, and that's when we realized that people have this need. There is a gap in the community in terms of diabetes and cholesterol levels, because blood pressure, diabetes, and cholesterol, they share the same risk factor: diet, stress, lifestyle. And that's where we thought it needs to go beyond blood pressure. We can help the community at a bigger level. And that's where the CVD community project happened. It started about 6 months ago in about October 2025. And so now what we do is, the CVD team does is, we go out in the community. So that could be different context places, like we have been out to mosques, number one Riverside libraries. We have been to community organizations like KYP, Aspire to Inspire, Deeplish community centers, and so on. And what we do is we give a complex healthcare need and approach. So what we do is we do something called health checks. These are completely free, and anybody can walk in, or anybody passing by can just approach us and have it done. So what we do in that is we conduct blood pressures. After the blood pressure is being conducted, we do height and weight. And then it is led by cholesterol and diabetes check. The best part about this health check is it takes only about 20 minutes to get your results done. And once your results are given to you, you are also given tailored health and lifestyle advice based on your results. And if, God forbid, if somebody did have high levels of diabetes or cholesterol or blood pressure and they did not know how to manage it, and we would refer them to our health coaches as well. So we ensure that they get that tailored approach. They are aware of their health. They know how to make a stance. They know how to maintain and improve the quality of life which is being affected by these diseases. So that's how the CVD project came from.
Say myself,
Yeah.
I've come here today
Yeah.
and you do a health check on me and I've got high diabetes, high blood pressure, and now you're going to do a referral for a health coach.
Yes.
What's the kind of waiting time before I can see a health coach to get
Okay.
that support?
Okay, so once the health check has been conducted, there are two things that occur. The first is, if you're local, we give the results to your GP as well,
Okay.
and the GP contacts you after they have received your results. That's one approach. The second approach is, if people would like to receive further help, sometimes people want to try by themselves to take control of their health, and we respect that. However, if they need that extra help, what we do is we have a system in Living Well where we fill a form, and that form gets referred to the health coaches, and as per their earliest availability, they get 6 free sessions for health coaching. That's about once a week for 6-week sessions.
So what kind of impact are you seeing from offering these free community health checks?
The community is happier. That's first thing and foremost. They really feel glad that they have this early access and support. A lot of the people who physically feel well, and when they do the health checks, they realize that something else, the body, the results was telling something else. And once they figure out, they always feel glad that they were able to have this health check and find these conditions earlier and be able to manage the conditions earlier as well. So it's about preventing late-term complications because diseases like diabetes, cardiovascular disease and blood pressure and even oral health are silent killers. You often don't see the symptoms before it's too late. So in terms of cholesterol, in most cases, there is no sign or symptoms. However, with diabetes on the other end, people do have, they feel the symptoms of dry mouth, thirst, frequent urination, feeling tired and so on. But often these signs are so subtle they can be ignored. And always this is my key and my messaging for today would be, even if you feel healthy, get yourself checked because it's like an investment for your body.
To a GP, you book an appointment if something's wrong with you and you go and see them. Whereas you're already out there in the community.
Yes.
And if someone's already, say, in a community centre, they can always come over, have a check.
Yes.
And they might not know about having this illness, and then they'll find out information. And not only information, they'll also get guidance on how to go about it. So that's really crucial. You run well-being walks. What role do these play beyond just physical health?
So in terms of the well-being walks is beyond the physical health component, it gives the community a sense of belonging. Because the chatters or the chatty cafes which handle the well-being walk, they deal around isolation and loneliness. And often with these issues, there is a lack in sense of belonging for the community. So what it does, it strengthens community bonds. It allows people to feel a part of the community, which is very, very important, and be there to support each other on an individual and a community level.
There's also a chatters or listening service. How important is this, having someone to talk to?
It is very, very important to have somebody to talk to. So according to research, issues like isolation and loneliness can lead to further worse outcomes. So they are associated with more likeliness to use of drugs abuse or uptaking of increased alcohol intake or smoking use to tackle the isolation and depression. Smoking and alcohol and the usage of drugs not only impacts the individual, it impacts the whole community and the loved ones as well. And to prevent that from happening, that's very important. In terms of depression and isolation, the best way to tackle these is prevention. And that's where the chatty and the chatty cafes and chatters step in and ensure that there is activities conducted out together, like walking. Sometimes they do coloring, sometimes they do knitting, and they do artwork. So that really gives them a sense of belonging, that gives them happiness that they have somebody to share with. And often what we have seen is people walk away happier than they've come in with.
How do you reach people who might not normally engage with health services?
That's a very, very nice question. How do we deal with people who normally don't engage in health services? We take multiple approaches in this. For example, the staff which we have, that includes multiple ethnicities and we speak multiple languages. So that helps reduce that language and cultural barrier. As well as we offer volunteering opportunities for people to get involved with us, to be able to give back to community. So that's a second way of, because we have a lot of volunteers from different ethnic backgrounds. We have volunteers from all the way from the Gulf to African communities to British. We have from all over the globe. So what this does is this helps us ensure that we are looking at the community from all lens. We understand all the barriers and the different types of barriers being faced. So that could be as simple as, like I said, language barrier, access to healthcare, cultural differences, underserved communities and groups, unemployment, and so on. So each lens viewed by us is each different way of tackling that cause.
So what kind of partnerships do you have with local organizations and community groups?
Like Living Well, Deep Lish Community Center, KYP, they all have this mission to serve their communities, and that's where we all combine together in terms of each, like I said earlier, each one has a different lens and a different approach.
Yeah.
So the way Living Well approaches its people and the way Deep Lish Community and KYP approaches their people, what we try to do is we try to combine all the visions. So sometimes, like I said, most of the work we do is outreach work.
Yeah.
So whenever we step into the organizations like KYP or Deep Lish and so on, what these communities do is they try to advertise the health checks and the services we offer. They try to call in other organizations as well. So whenever a client or a patient walks in through the door, they have this access to multiple stores, multiple services. So that could begin with unemployment, from health services like Living Well, loneliness, charter support, housing. There's so much skills and employment. So it's like, in a simple term, it's like a mall.
Yeah.
And instead of stores, you have healthcare stalls.
Been to one of the health seminars where
Yes.
yourself as an organisation, NHS,
Yes.
so there were different stalls set out for
Yes.
people to visit. And the good thing about it is, so places like Deep Lish Community Centre, KYP, they have their own groups.
Yes.
So be it elderly, male group, elderly women's groups, where they attend the centre.
Yes.
And then you've got access to them,
Yes.
and they've got access to you, more
Yes.
importantly, because otherwise you'll be routing around Rochdale looking for people,
Yes.
and no one has time.
Yes.
So if they're already there as part of a group, say socialising or
Yes.
whatever subject they're doing, from what I see on your Facebook, you're often out at events. How important is it for you to be visible in the community?
Very, very important. So, although Living Well is based at Lock 50, most of our work is conducted out in the public. And sometimes people do attend the Living Well at Lock 50 for services by health coaches like smoking cessation, diet, lifestyle, chatty groups, and so on. However, we understand that sometimes people might not be able to access due to transportation and not knowing how to access that support. So by going out in the community, like you mentioned in terms of Deep Lish, they have a phenomenal way of being advertised their services. And I've seen whenever they hold on to classes, they're like, for example, women classes, women empowerment, a lot of those women like to attend those classes. And for the community, that builds a sense of belonging. It more, rather than becoming like an organization, it becomes their second home.
Yes.
It's like I've seen people talking with each other in terms of as if it's their second family. They eat together. They are very, very happy. They do activities together. They grow. They learn together.
Yeah.
So, coming back to your question, how important is visibility? If organizations like KYP, Deep Lish, Living Well, and so on, if we didn't go out in the community, people would not know how to access these support services, because often people who need the services the most are least likely to access them or least understand how that these exist and what benefit they could get from it.
You mentioned helping people overcome barriers like isolation and mental health challenges. What are the more common barriers that you see?
So, because I work with the CVD team and the oral health team, so in terms of them, one of the barriers where I've seen is the perception of health needs. Most of the people we conduct health checks on, they tend to believe that because they're physically fit, they are quite well and they don't need a health check. And often with those subjects or people, we have also realized is because Living Well has conducted over thousands of blood pressure and over 5,000 health conversations. What we realized is when people do come to us and they have that health check conducted, they often fail to realize that a healthy physical body does not mean that what's happening inside your body is good as well. It's always good to have yourself checked, because in so many cases people often tend to get shocked, and when they see the results differs from what they actually believed in, and that's where we try to help them explain. And because we understand it's quite a shock to them, we tend to offer emotional support first, and then the physical support, because many people sometimes tend to get stressed. That's the second barrier. People often get stressed whenever they see health checks because they feel scared that what if I am diabetic? What if I have high cholesterol? And they rather not get themselves checked. And we try to explain to them that even if the results were to be diabetic or to be high blood pressure or to be cholesterol, we are there for you. We will do whatever it takes to get you that support. Either it's with that GP, we'll help you how to access your GP. For example, we give letters to the GP, or we can signpost them to other services and organizations like Deeplish. And for them to understand that organizations like these are for you. We are there for you. Whatever help you need, if you don't understand it, it's okay. If you have a culture barrier, it's okay. If you can't access, we will come to you. Don't think that there are barriers to accessing our services within any organizations in Rochdale. Like I said, it's a very culturally rich area, and somewhere out there, we will find you a community, or we will make you feel a part of a community for you to fit in.
How do you support people who may have tried to make changes before but struggled?
So we believe in something called the social determinants of health. There are two approaches to health. So first is that health is an individual choice, which many people tend to believe that in terms of an individual has that control over their diet, their lifestyle, their access to healthcare and so on. However, we tend to take the latter approach, which is health is not just defined by the individual, it's defined by his surroundings. So that could differ from housing, the type of housing the person has, the type of employment the person has, access, whether they're able to access the service, whether they are physically able to have that choice to go and get that access to healthcare, whether they have that knowledge, whether they're aware of how, when, and where to access those healthcare services. And because health is something that transitions with your life, in some parts of your life, your health might be at its peak. On other parts of your life, with your housing, with your relations in the community and so on, health tends to be directly proportional to those. And that's where we understand that whilst at some days or some time of your life, you might have or feel that you are able to tackle any diseases or smoking cessation, for example, by yourself. However, or on other days where things in terms of your society or surroundings do influence you as well, because of your social determinants of health, on some days it might become a struggle to take care, and you might have those fall or setbacks, and that's completely normal. We understand these changes in terms of life and society and so on, and we always encourage people at the end of the day, even if you fall back, we will still be there for you.
We know conditions like diabetes and heart disease are most common in South Asian communities. Can you help us understand why that is?
So yes, that is quite true. According to what we have seen practically and what we have seen in research as well, is that certain ethnicities like the South Asian population as well as other minor underserved communities are more prone and likely to develop conditions like diabetes, cholesterol, high blood pressure, and so on. As a matter of fact, there is research by the British Health Foundation, and what they have suggested that the South Asian population is twice as likely to develop these conditions. More so often, this includes incidents across all age groups. So from the young all the way to the elder age, they all have the risk of developing diabetes and high cholesterol levels. Apart from that, if we were to speak about biologically why this happens, is it's the way our bodies store fat, even with lower BMI levels. That means more visceral fat around the waist, a pot belly, increased insulin resistance. These are often found in the South Asian community. More so often, to add that alongside that, is the South Asian community are more likely to deal with complications of diabetes that include vision loss, kidney disease, so on. So it's not just the incidence of the disease, but it's also the complications at earlier age, and this impacts the quality of life.
So is there a certain criteria that someone needs to meet to get access to these facilities that you're offering?
So yes, there are a few criteria in terms of health checks. First and foremost being is they must be above the age of 25.
25, right, okay.
The second criteria is if they are pregnant, we don't do health checks just because the results might not be accurate in the reflection of that condition.
Right.
The third being is if they are already being diagnosed with cardiovascular disease and diabetes, because this means that they already have access to their GP and aware of the conditions. So what we try to do is we are trying to find that community or population which have not been diagnosed or have their health check done already by the GP and they want to redo it, so that's okay. And lastly is if they are on medications like blood thinners or medication for diabetes or cholesterol as it is, that's where when we don't do health checks.
So we're coming towards the end now. I want to ask you a couple of bigger picture questions. What concerns you the most right now when it comes to health in these communities?
So what would concern me the most is the quality of life. So when we speak about conditions like diabetes, cholesterol, lung disease, oral health, and so on, it's the quality of life that's impacted. So from a public health perspective, we don't only believe in life expectancy, we also believe in the quality of life. For example, an individual A who is healthy and lives for lives for 80 years compared to individual B who might live for 100 years but has been diagnosed with diabetes and cholesterol or any chronic existing condition. The quality of life, although the years are differs for individual A versus individual B. So what we try to do is we try to minimize the complications regardless of the life expectancy to ensure that that particular individual or the community can spend their lives in a better way with reducing long-term complications or even serious life-threatening complications.
Thank you so much,
Thank you so
Suhail Bhai,
much.
from Living Well. I really
Likewise,
appreciate it. Yeah.
it was a pleasure.